Hey everybody, I'm your host, Dr. Bob Lee from 107.5 WBLS, and you're watching Open. It's that live interactive program that brings the Bronx and New York City straight to your TV set. Stay connected to us through social media at BronxNet TV. Leading things off, our first guest is the Chief Growth Officer for MetroPlusHealth. And he joins us to speak about the open enrollment period. Everybody's talking about open enrollment. Now, these periods are very, very, very important because this is the time where you can switch off and do different things. And he's going to be talking about affordable health care insurance plans being offered to people in our community and so much more. So please welcome to the show, Roger Milliner. Well, Roger, welcome.
Hi, Bob. Thanks for having me.
Hey, I just saw you last week.
Yes.
And you're always in the community.
That's my job.
And you're always doing this. Always got your sleeves rolled up, taking care of business, you know, making sure that everybody gets the information. You always create the awareness that there's something special in somebody's life that they need to take care of or take a look at. So tell us a little bit about what you do at MetroPlusHealth.
So my role at MetroPlus is exactly what you said, to make sure that I provide people with the knowledge and information that they need to make informed decisions about their healthcare choices and healthcare options. Healthcare is very complicated. It's always been complicated, but even now more so because of a lot of the changes that are going on in the current administration in the White House. We have a lot of confusion about, you know, what people are eligible for, you know, how can they take advantage of it, where do they go to enroll. So my teams and our job is to make sure that we are available and accessible to people to demystify the confusion about healthcare and in the insurance industry.
Yeah, I know there's a lot to talk about in this segment, but I want you to just jump in. If you feel that there's something more important than something else, prioritize and jump in and say, but what makes MetroPlus stand out above the others?
Well, what makes us different is that we're a community-based plan. We're a community local health insurance company. There are many health insurance companies. Some are national in scope, where they cover multiple states. Others are more regional, where they may cover a few states around each other. MetroPlus is a local plan. That means that we're in the community, where, as you said earlier, we're owned by the New York City Health and Hospital System, which is the country's largest municipal hospital system. And so that means that we're not distracted. All of our attention is to make sure that New Yorkers and the surrounding counties get the full attention that they need. You'll see us out there at our community offices, and we have about 9 of them scattered throughout the city, where people can come in person and see somebody who lives, works, and knows, you know, particularly the city like they do.
Yeah.
We speak over 40 different languages, and if we don't, there's a translation service that we use. So we're very community-centric and local in our community.
Yeah, and then there's somewhere that you can go. If you want to go to the emergency room, you can go straight to one of the locations that you guys offer.
Like I said, we have 9 community offices. We're building 2 more. We have recreational vehicles that serve as mobile offices. You'll see us all around in the communities. You can go to any one of the 11 Health Plus Hospital city hospitals, and you'll find my staff there. You can also visit us online. We have a website, www.metroplus.org. You can call our dedicated sales line, where there's hundreds of reps on standby waiting to answer questions and calls. You can roll over the phone. So there's multiple ways in which you can get in touch with us.
And we were talking about mental health in another segment. Of course, you guys cover that also.
Sure. We have a virtual care benefit that people can take advantage of. So if anybody wants to avail themselves to care 24 hours a day, 7 days a week, they always can call our virtual telehealth service. That provides them with behavioral health expertise, mental health expertise, or medical expertise. Sometimes it's not all about just, you know, I have a cold in the middle of the night and I want to go to the emergency room, or my child has a fever. What should I do? Before going to the emergency room, you can call our telehealth service and they can give you the best advice. Someone may be having a panic attack or anxiety. That's more behavioral or mental. They can also call our dedicated 24/7 behavioral health line as well.
Let's talk about the MetroPlus Medicaid and Medicare.
Right, so now you're getting to the open enrollment periods that you mentioned.
Open enrollment periods.
So there are actually 3 different open enrollment periods taking place right now. You have, first and foremost, the open enrollment period for city employees, their family members, spouses, and dependents. That is going on now until the end of November. So if you're a city employee, I urge you to explore the options that are available to you. MetroPlus is one of 13 different health plans that you can choose from. So that's taking place until the end of November 30th. In addition, we have the Medicare Advantage open enrollment period, which is for people on Medicare.
Yeah.
They can either have Medicare because they have Medicare and Medicaid, or they can have Medicare by itself. They have until December 7th in order to transfer from one plan to the other or switch.
Yeah.
Or if they're just becoming of Medicare age, they can join during this period of time.
And what is the process of maybe signing up for MetroPlusHealth? You want to switch over
Sure.
to your medical plan?
So there's a variety of ways. Like I said, if you are a city employee, please call us at 1-877-475-3795. Or you can visit our website at www.metroplus.org. There you can find ways in which you can also get in touch with us through one of our Zoom sessions where we'll be having information about the changes and the benefits. You can also go to, besides our website and our telephone number that I mentioned earlier, you can visit us in person.
That telephone number again is 800?
So if you are a city employee, it's 877 475-3795. If you're a Medicare recipient and you want to switch or join, you can call 833-965-1526.
Got it.
And lastly, the third open enrollment period that people should be aware of is for anybody who has their coverage through the Affordable Care Act, aka Obamacare.
Obamacare.
So this is the time of year up until the end of December 31st, where people who are currently on one of the Affordable Care Act programs, they can switch or join our plan as well.
Beautiful. Now, we heard something about Flex Care. Of course, we got a guy named Flex on Hot 97.
That's
Talk
right.
about that Flex Care program,
All right,
or
so
Flex Card.
Let's talk a little bit about the Medicare Advantage plan. So Medicare Advantage, if you're a senior or you have Medicare because you have a certain health condition, you're on SSI or something like that, there's a benefit called OTC. Everybody knows the OTC card, which stands for over-the-counter.
You down with OTC?
Over-the-counter of drugs, right? We made it a little bit more enticing. So now our OTC is also an OTC Flex benefit. So you can definitely get over-the-counter medication or items, but you can also use it for groceries. If you want to shop at a grocery store, we have thousands and thousands of local grocery stores that you can go to go shopping. You can use it to pay your utility bills. So if you're a senior and you want to use some or portion of your OTC Flex benefit, you can actually pay some of your utility bills, your cable, your light, your telephone bill, your cell phone bill, etc. You can also use it for personal safety items. Let's say you need a rail in your tub, in the bathroom. You can use it for personal safety items. You can use it for the famous I've fallen and I can't get up, the PERS, Personal Emergency Response System. So that's the reason why we call it Flex, because a person can actually mix and match what they want to use it for. The good thing is that you get $500 to use every quarter. Yes, $500 a quarter, that's $2,000 a year that someone can take and mix and match and spend it all on utility bills or all on groceries or groceries and utilities together, whatever they choose to do.
And what stands out in your mind that you think you need the public to know more about?
In addition to that OTC benefit, a person gets a rewards program. We're all about wellness and healthiness in MetroPlus. So we have a rewards program, particularly the one for Medicare recipients, as I just mentioned. They can go and get they can use the rewards program to do simple activities, going to your annual physical to get a checkup, drinking water, taking a certain amount of steps. It's a variety of ways in which you can use it. And that value is up to $450 a year.
So you could join a health club or something like that?
Yes. Well, with the gym reimbursement. I'm jumping back and forth.
Yeah, you're getting in there.
If you're a city worker and you want to use the gym, we reimburse you for your gym reimbursement. $500 a year for yourself, $500 for your spouse, and up to $400 for 2 children a year. That's a value of $1,400 in gym reimbursement. If you're somebody who doesn't like to physically go work out, we have a wellness app that people can just get $300 a year to apply towards the payment for their wellness app. So for example, if you're on Peloton, Noom, you ride City Bike, any of those type of wellness applications, we will reimburse a city employee up to $300 a year.
That's deep. That's really deep.
Lots of benefits. We have a very robust network with over 34,000 providers. That's one of the things that make health plans unique, the size of their network and can you get care at accessible places. So we have over 10,000 primary care doctors in private practice, 25,000 specialists, 130 urgent care centers, 48 hospitals, 248 labs, 110 urgent care centers. I can go on and on. 1,400 behavioral health doctors.
Yeah.
So our network in the 5 boroughs is really robust, and we're expanding to Nassau, Suffolk, Westchester, and some of the outlying counties. So that's very important.
So you got everybody covered.
We got them covered. If that's not enough, we give our city employees $100 free drugs. So the basic plan is free. There's no premiums, no deductibles, no co-pays. On top of that, if you needed the option rider, which is the only thing that there's a payroll deduction for, you don't really need it, because you should take a look at our 100 free drug list, where you can get most of the common antidepressants, contraceptives, all types of blood pressure medication, diabetic medication. Take a look at the drug list on our website, and you'll find that the drugs that you take on a regular basis is part of our benefit package. So there's no need for the drug reimbursement program.
Do they have a telehealth program?
Yeah, I mentioned earlier, telehealth is available 24 hours a day, where you can get behavioral or medical needs taken care of before going to the doctor. It's a really good program.
Yeah, because I wanted to bring that back, because people sometimes, let me check and make sure.
Yeah.
Because I don't want to be sitting in an emergency room, and I don't know if I want to go to a spot. Let me make sure before I leave the house.
Most people don't want to go. They don't want to run out in the middle of the night, even during the daytime, because sometimes there's a wait, whether it's the emergency room or urgent care center. Having a doctor, not a nurse, an actual doctor that's going to pick up the phone, diagnose you. It's a virtual visit, so they're examining you virtually, and they're getting most of the information, and may find out they could just call in a script for you, and you don't have to even go. So many people have been taking, especially since COVID, a lot of people have been taking advantage of that virtual care program that we offer. And
a website that we can go to get more information?
More information,
It's all right there, right?
Right there. www.metroplus.org is where you can find information about where you can learn about a virtual seminar that people can get information. You can look up our benefits. You can see our network. You can see the drugs that we offer. Our labs, they're all listed on our website. Please visit us there.
Give him a big round of applause, everybody. Chief Growth Officer, MetroPlusHealth Incorporated, Roger Milliner.
Thank you.
You know what? Before we go, give me those phone numbers one more time. I know you said 877-475-3795. That's for the city workers.
City workers. If you are a Medicare recipient and you want to switch health plans during this open enrollment period, you can call 833-965-1526.
Hey, man, we appreciate you. Thanks for coming on.
Thank you.
Come back again. You're always welcome.
Thank you.
All right. We'll take a quick break right here. I've got more open coming your way next.